Illinois is expanding its vaccination effort. Today, 150,000 first dose appointments will open at several Illinois-run mass vaccination sites and pharmacies. This comes as the state prepares to expand eligibility to people 16 years old and over starting Monday. Chicago will expand age eligibility the following Monday. Joining us now to talk about all this is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Morning.
I know we talked about this yesterday. I think it bears repeating. We see these numbers going up, and there's worry about numbers being bad in Chicagoland and in Illinois. But you say it's this race against the vaccine because we wonder, why are these numbers going up when the vaccines are out there?
Yeah, well, this is the next phase of this whole pandemic. What's happened here is similar to what happened in the UK and what's happening in Europe right now, is that these new variants came in. Fortunately, we have a quarter of the people fully vaccinated in the United States now, which is really amazing and going in the right direction. So that's helping us a little bit, but not enough. These new variants virus, they transmit much easier. They may actually even be more deadly. It is just not looking good. We have to push this vaccine as fast as possible because they still do protect you against these new versions of the virus.
But when you hear how much more dangerous the Brazil variant is, it makes me wonder, how are they doing with vaccinations down there?
Oh, Brazil is it's a disaster down there. They have very poor leadership at the top. They don't have the resources. They're not. It's just the whole plan is. It's really a mess down there. It's very unfortunate what's happening to those poor people.
And so, it makes me wonder that, I know the Brazil variant is here, but is it inevitable that it'll be prevalent?
Well, that's a very good question. It still is only taken over in Brazil. We do have cases here. It's the second most common bad variant here in the United States, but it's a very small amount. But if this thing really transmits faster, it could take over. But I think we're going on the right track with the vaccines and to get the whole numbers down. But as you saw with the cases today, there's 80,000 new cases yesterday. This is, up from just in the 60,000s just a couple weeks ago. So we've got to get these vaccines out there as fast as possible.
All right, let's get to some viewer questions. Now that we have so many people vaccinated and creating antibodies, is there a reason we can't then transfer those antibodies to unvaccinated people so they wouldn't need the vaccine itself? Or is that too simplistic?
No, I mean, theoretically that sounds terrific, but the vaccine makes huge amounts of antibody compared to transferring passive antibody from one person to another. So the vaccine just works so much better.
All right, next question. My office in the western suburbs just informed us we are no longer required to wear masks in the office. There are 18 employees. There is no option to work from home. Aren't employees in Illinois still required to wear masks at work?
Well, they should be wearing masks at an office like this. There's no mention here if everybody in the office is vaccinated or not. But even if they were, the recommendation now is that you should continue to use these masks. As this pandemic we're going into a new phase of the current wave, this is not the time to pull back and put these people at risk. This is just frankly wrong.
All right, next question. My husband and I have both received the vaccine and are past our 2-week waiting period. We know we have to continue wearing masks, but should we still be double masking?
Yeah, there's no correct answer here. The masks help, the vaccine helps, double masking helps even more. I guess it depends really how risky your situation is. Are you around people that are likely to be infected? I think for all practical purposes, a vaccinated person, can just wear a single mask. But it just depends on the situation that you're in. There's no right or wrong answer.
All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again on Monday. Have a good weekend.
Have a great weekend.
Thanks, Doc.
Hello, Paulie.
Hi, guys. Looking at cloudy